Hi everyone, I am Bhuneshwari. Welcome to BSP Nursing Points channel. We will cover child health nursing topics here. Let's learn together. Our today's topic is assessment of newborn. Let's see the introduction. Assessment of newborn must be examined thoroughly within 24 hours of birth. The next point is newborn assessment is done as soon as after birth as possible. The mother should be allowed to spend some time with the baby immediately after the birth to initiate the bonding process. It is a comprehensive evaluation starting immediately after birth and continuing throughout the neonatal period to identify the abnormalities or medical conditions that could be affect the baby's health and development. So here, identify issues like congenital heart defects, infections, or jaundice or breathing problems, and also confirms the baby's heart rate and breathing temperature and establishes initial health records for monitoring growth and development. Next, purposes. So here, what are the purposes of assessment of newborn? First one is to understand the physical and mental well-being of the child and to detect the disease in early stage and to determine the cause and effect of the disease. Next is steps in assessment of newborn. What are the steps involved in assessment of newborn? There are four steps. First one is immediate assessment with UPCAR score. Second one, the transitional assessment during period of reactivity. Third one, physical assessment. Fourth one, gestational age assessment. We'll see one by one. First one is immediate assessment with UPCAR score. So here the first point is it can be completed by UPCAR score system which is developed by the Virginia UPCAR in 1952. The UPCAR score is developed by Virginia UPCAR in the year of 1952. As a simple, it is a quick way for doctors to assess the newborn's immediate health at birth, to see if they needed urgent resuscitation and standardizing evaluation for the color, heart rate and reflexes, muscle tone and respiration. See, the next point is the score is based on the observation of the heart rate, respiration, muscle tone, reflex irritability and color of the neonates. The UPCAR score is based on the respiration, muscle tone, heart rate and reflex irritability and color of the neonates. The next point is the assessment should be start immediately after the birth at 1 minute and 5 minutes after the birth. Here, each item is given a score of 0, 1, 2. If strongly positive, it is 2. And if it is negative, it is 0. The next point is, during this, many newborn may appear pink and may have slight bluish color hand, feet due to external environment. Yes, it is a normal for newborns. Hands and feet to have slight bluish color after the birth because of immature circulation and cold exposure, crying or adjusting to the breathing air. So these are the common problems. Next, UPCAR score. What UPCAR stands? A stands appearance, means skin color. P pulse, means heart rate. G grimacing, reflex responses. A activity, that means muscle tone. R respiration or breathing. Next, the UPCAR score system. The UPCAR test is usually administered twice, once at 1 minute after birth and again at 5 minutes after birth. Each of the 5 signs is given a score of 0, 1 or 2. And the individual scores are then added up to get a total score ranging from 0 to 10. So in first sign is appearance or skin color. Assess the baby's skin color. A score of 2 means the normal all over, while a score of 0 indicates the baby is bluish gray or pale color. See here, the baby's whole body is bluish in color, so that score is 0. The extremities in this image, the extremities are bluish in color and body is pink. So then score will be 1. So this condition is also called as acrocyanosis. Next, the baby whole body is pink, then score is 2. Next one is pulse or heart rate. Evaluates the baby's heart rate, which is critical part of the assessment. A heart rate above 100 beats per minute, the score is 2, while no pulse and score is 0. So here no pulse means our score is 0. If heart rate is less than 100 beats per minute, the score is 1. If it is more than 100 beats per minute, then score is 2. Next sign is grimace or reflex irritability or reflex response. Check the baby's reflex irritability. A strong response like crying, coughing, sneezing. So then score is 2. If there is no response, then score is 0. If minimal response is present, then our score is 1. So the prompt response like sneezing, crying or pulling away when stimulated, then score will be 2. Next sign is activity or muscle tone. These are the muscle tone active movement of limbs, score 2, while a limb baby score is 0. So there is no movement, then score is 0. Flexed arms and legs, extremities are in flexed position, then our score is 1. If active movement, then score is 2. Last sign is respiration or breathing. Assess the baby's breathing effort. A strong cry and normal breathing effort, the score is 2. If no breathing, our score is 0. If irregular breathing, then score will be 1. If strong cry, then score is 2. So this image is also give the clear explanation of Apgar scoring system. Next point is babies normally have a score of 8 to 9 within the first minute after the birth. So at 1 minute, the normal baby score is 8 to 9. When score is between 8 to 10, it indicates the newborn is easily adjusting with the extra-uterine environment. The score, if score is 5 to 7, between 5 to 7, it shows moderate difficult of newborn to adjust to the extra-uterine life. If the score is between 5 to 7, so it is quite difficult to adjust with the extra-uterine life. And the score of 4 or below 4 shows the severe distress and may require an endotracheal intubation or close continuous monitoring. So this is all about Apgar score system. So in next video we are going to discuss next one, transitional assessment.